It's hard work being a cancer survivor. I know it. I live it. There's a lot of, there's not just your routine care, but then there is your monitoring and all the exams that go with that. Another concern for breast cancer survivors, women are naturally predisposed to cardiovascular disease. And so women think that if they go to their medical oncologist, they've accomplished their internal medicine exam, when indeed they haven't. And they still need an internist, and they still need to check for other diseases, and they are at risk. And especially if they've had certain toxic agents that could predispose them to even greater cardiovascular or cardiac risk. And these women I talk to, I'm baffled, have, they reach age 50 and still haven't done their cardio exams.
Yeah. Yeah, they need to have an internist. I usually tell them to keep the internist, and I said, I don't see them as often as the internist should see them, and so it's very important. The other thing, I've used my survivors to be advocates of, how they are, a picture of survivor because they have gotten their mammogram, and sometimes, people in church talk, friends. So I've used them as being spokespeople, patients for their success, and that is very effective because that's people I would never meet.
Peer support.
Yeah, and so I think that's helpful.
But Selma, I can't emphasize enough what you just said and how correct that is. I surprise my patients when they're coming in for even their first 6-month follow-up. When the first question coming out of my mouth is, so how has your cholesterol been doing? And I comment about the blood pressure that they got coming in, and reminding them, and I think they even like the fact that, what, he is actually more concerned about my blood pressure right now than my cancer. And then I explain to them that you're most likely, what's going to keep you from the term I always use, what's going to keep you from your 95th birthday, because you have a little bit of diabetes and you have high blood pressure and elevated cholesterol, is heart disease, not this breast cancer. So I start off with that, and then we move into talking about how we're doing with the anti-estrogen pill. Tell me about aches and pains.
It's an integrated medicine approach. I want to thank you, Dr. Jeffrey Hargis and Dr. Sasha Vukelja, for sharing an overall perspective of what you're leaving the meeting with, and also it's your philosophic viewpoints that you've shared also on how to run your practices. So thank you very much.
Thank you.
Well, thank you for having us.
Thanks. Same time next year?
That'd be wonderful.
That's
Good
right.
seeing you both.
Nice. Thank you.